So students, today we are going to learn about something about organ transplantation. Organ transplantation is unique among surgical procedures. Procedures cannot take place without the donation of an organ or a partial organ from another person. Since 1988, more than 390,000 organs have been transplanted. Organs that can be transplanted commonly are heart, intestine, kidneys, lung, liver, and pancreas. So types of donors are either it could be a living donor or it could be a diseased donor. In living donors, the donors remain alive and donate a renewable tissue, cell, or fluid, example, skin or blood, or donates an organ such as kidney or a portion of liver or lung lobe. And the second is diseased donor, people who have been declared brain dead and those organs are kept viable by ventilators or by other mechanical mechanisms. In 2005, 7,593 diseased donors provide more than 23,000 transplanted organs in the United States. And these were more than 6,000 living donors. More than 2 million people need organ transplantations in China every year. 50,000 waiting in Latin America, more than 90% of which are waiting for kidneys, as well as thousands more in less documented continents of Africa. In Latin America alone, the donor rate is 4,200 per million per year. Organ transplantation is a medical procedure in which an organ is removed from one part of the body and placed in the body of a recipient to replace a damaged or a missing organ. The donor and the recipient must be at the same location, or organ may be transported from a donor site to another location, such as we commonly see these days that some green corridors are being made. So green corridors are basically for transplantation of a organ, because all removed part have a time for in which they have to be transplanted in a recipient. Organs and or tissues that are transplanted within the same person's body are called as autografts. Transplants that are recently performed between two subjects of the same species are called allografts. Organ donation may be living, brain dead, or dead via circulatory death. Tissue may be recovered from donor who dies of circulatory death. Unlike organs, most tissues, with the exception of corneas, can be preserved and stored for up to five years. This means they can be banked for more than 5 years. Other types of grafts are isografts. An isograft is a graft of tissue between two individuals who are genetically identical. Example are monozygotic twins. Isografts are different from other types of transplant because while they are anatomically identical to allografts, they do not trigger any immune reaction. Then second is a split transplants. Sometimes a diseased organ, usually a liver, may be divided between two recipients, especially an adult and a child. They are not usually a preferred option because the transplantation of a whole organ is usually more successful. The next is a xenograft. Xenograft tissues are the organs from an individual of one species transplanted into or grafted into an organism of another species, genus, or family. Now we come to organ rejection. Transplant rejection is a process in which a transplant recipient's immune system attacks a transplanted organ or a tissue. Mismatched organs or organs that are not matched closely enough can trigger a blood transfusion reaction like. Now the types of rejections can be a hyperacute rejection or acute rejection or a chronic rejection. Now what is a hyperacute rejection? Hyperacute rejection occurs within few minutes after the transplant when the antigens are completely unmatched. The tissue must be removed right away or the recipient doesn't die. This type of rejection is seen when a recipient is given the wrong type of blood. For example, when a person is given type A blood when she is or he is type B. Now the second is the acute rejection. Acute rejection may occur any time from the first week after the transplant to 3 months afterwards. All recipients have same amount of acute rejections. Chronic rejections can take place over many years. The body's constant immune response against the new organ slowly damages the transplanted tissue or the organ. Problems of organ transplantation. The most important and the foremost is the infection. You will be given fairly high doses of immunosuppressant medications that will make you more susceptible to infections. During the first few months, the most common site of possible infection are your chest. Cytomegalovirus infection is a viral infection which usually comes on about 4 weeks after transplant. It causes fever, aches, and pains. When organ rejection is suspected, one or more of the following tests may be done before the organ biopsy. These are abdominal CT scan, X-ray chest, echocardiography, kidney arteriography, renal ultrasound, and lab tests for renal function and liver functions. Now the post-transplant medications. Anti-proliferative medications like azathioprine and mycophenolic acid. Calcineurin inhibitors like cyclosporine, teclistamab, and mTOR inhibitors. Sirolimus and everolimus. Thank you. कहाँ से होगा?
Okay, so